Hundreds of reports from people who've linked problems with their pancreas to weight loss jabs. The Medicines and Healthcare Products Regulatory Agency has launched a new study into the potentially deadly side effects. It's an issue our health correspondent, Rebecca Barry, first highlighted back in November. Rebecca joins us now. Just how concerned should people be about this?
Well, we have known, and as you say, we've exposed this on ITV News, about the uncommon but potentially fatal side effect of weight loss drugs.
As an endocrinologist, it's very frustrating for me because this kind of news report is what gets, clicks and attention, and also what incorrectly influences many patients. I've seen many patients like this to not take these medications because they are afraid of them because of news reports like that. If you look at the actual data, there have been many studies which have shown that GLP-1 medications are probably not associated with an increased risk of pancreatitis. Multiple studies, I'll put them here on the screen, have shown they've looked at 1 million patients with type 2 diabetes and compared them, the users of GLP-1 to not users of GLP-1. One of the most impressive, I think, looked over 5 years, and a lot of these are prospective randomized controlled studies, the best kind of research studies. At 5 years, the study February 2025 showed that 0.3% of patients with type 2 diabetes developed pancreatitis at over 5 years on a GLP-1. 0.4% of patients who were not on a GLP-1 with diabetes developed pancreatitis. Because there were so many patients in that study, that was actually significantly lower risk of pancreatitis on a GLP-1. And other studies likewise have suggested that. Now, the problem is with a lot of this is patients with diabetes have a higher risk of pancreatitis, whether they're treated with a medicine or not. Patients with obesity have a higher risk of pancreatitis, whether they're treated with GLP-1 medicines or not. So absolutely, you can have pancreatitis on these medications. The problem is it the medication that causes pancreatitis or the disease? And probably what these studies are suggesting is that probably it was the disease process that caused the diabetes or the obesity that caused the pancreatitis and not these medications. So I wouldn't say we know this 100%, but certainly the data are very reassuring. If you look at all of these different studies which have tried to figure this out by compare active comparators, propensity matching scores, meaning they're trying to do their best to figure out in this big population of patients with obesity, patients with diabetes, does it matter if you take these medications or not? Doesn't it look like they cause pancreatitis?